I'm so excited to introduce you to the best website designers out there. We have a brand new partnership with Session Sites. It is where good therapy meets brilliant design, and they get your website switched over or built in less than 2 weeks. They fine tune your messaging, use science backed user experience methodology, and work exclusively with mental health professionals. In fact, new clients right now are going to get 3 free therapy marketing strategy calls with their creative director of Session Sites if you book today. You're not going to want to miss this. Head on over to sessionsites.com/Joe. Again, that's sessionsites.com/Joe. Get the website of your dreams today. Sessionsites.com/Joe. This is the Practice of the Practice podcast with Joe Sanok, session number 1206. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast. Today, we have Dr. Frank Anderson, who is an MD and is world-renowned as a trauma treatment expert, Harvard-trained psychiatrist and psychotherapist. He's the acclaimed author of Transcending Trauma, recently released memoir, To Be Loved, A Story of Truth, Trauma, and Transformation, and the co-author of Internal Family Systems Skills Training Manual. As a global speaker on the treatment of trauma and dissociation, he's passionate about teaching brain-based psychotherapy and integrating current neuroscience knowledge with IFS. Frank, welcome to the Practice of the Practice podcast.
Thank you so much for having me. It's good to be here, Joe.
Yeah, I love all the work that you're doing. When you reflect on kind of brain-based psychotherapy, what do we get wrong when it comes to brain-based psychotherapy?
I love that question right off the bat. So I haven't said this out loud yet, which is kind of interesting. The thing that kind of drives me a little crazy these days is the way people on social media talk about the nervous system as if it's an entity. Regulate your nervous system. You got to calm your nervous system, like as if the nervous system is a thing that we can regulate or fix like that. And that's so reductionistic when we talk about our nervous systems as if we can do something with them in that kind of way. You know, when we look at the brain, there's like billions of neurons and billions of synapses and hundreds of chemical neurotransmitters. Our brain is so complex. There are so many networks that are interacting with each other. And it's like a drop in the bucket for us understanding the brain. So the effect that we have on our brain is so limited in our understanding at this point. Can we make people feel better? Can we help them with their thoughts? Can we help them shift their emotions or release some of the sensations that they carry in their body as a result of trauma? Yes. Can we help people get out of a depression or not feel as anxious? Of course. Those are symptoms. But we can't really talk about the nervous system as if we can have this kind of direct one-to-one cause and effect on it. It's much more global, it's much more systemic, and there's so many things in the brain that we don't know about. So we're just kind of scratching the surface. Now, having that being said, I think there's a lot to learn the way we know about the brain, and we can make some really important therapeutic decisions in our practices based on the current knowledge that we do have. So I'm not saying, oh, it's too complicated, forget about it. But what I am saying is let's take the information that we have right now and we can apply certain therapeutic techniques in a way that can really shift and change things, because the brain science helps us understand some of our symptoms and our reactions and our moods and our behaviors. So the more understanding we have of it, the more we can make our interventions in a way that's actually informed, instead of like, I've been doing this for 30 years and this is what I've seen has worked. Do you know what I mean? It's kind of turned psychotherapy into a science as opposed to an art. Obviously it's both, but we've had like not a great reputation in the medical field because of being a soft science. I think neuroscience knowledge helps us integrate art and science in a way that brings legitimacy, and structure, and a deliberateness to what we do.
Mm.
Long-winded answer there, Joe.
Yeah, but Frank, that's too nuanced for a 45-minute or 45-second TikTok.
Exactly.
The people don't have the attention span for all that.
Yes, that's right.
Well, I think the wonderful thing and the terrible thing about Instagram, TikTok, social
Yes,
media is that
yes,
it's really exposing people to mental health issues and
yes.
getting knowledge from experts directly. Um, where you could go out there and you could film something for 45 seconds and it would be good quality. And there's also a ton of armchair experts that, just like what you said, say they may be a therapist that says, I've been doing this for 30 years. They may also be someone that just says, for 30 years, I've been dealing with anxiety. So I'm an expert in my own anxiety.
Right.
When you think about how people consume information about the brain, like what bothers you, but also what gives you hope?
Yeah, and it is both. It's a bother and an excitement. Like I am very mixed about it. Like in some ways, I've been one of these ivory tower people since 1992. So I've been in that world doing research, writing books, working with the top people in the trauma field. So I'm in that ivory tower category, and in some ways that information is not accessible to the general public. Like there's a lot of important information that is not getting out there. So I'm grateful to all these people on TikTok and Instagram. I'm one of them now who is bringing access of information to the general public. So, in some ways, it's wonderful and it's bringing exposure out of the ivory tower into the general public. It's a bridge, and it's a really important bridge. You used the word trauma 10 years ago and people would flip out. Not me, not me. I didn't go to war. I haven't been raped, right? Now people really have a much better understanding of that word in a more general public kind of way, less stigma, less shame based attached to it. So there's that piece that I'm grateful for the access. The problem comes in for me when people, like exactly like you say, because they have a lot of followers does not make them an expert,
Mhm.
right? And when I'm on podcasts now a lot with people, some people are synthesizers and some people are imposters, right?
Mm.
I'm an expert because I have 3 million followers. No, that's actually not how it works. Versus, I want to bring some of the top people in the field to you folks because I'm a bridge, right? I think you had Lewis Howes on this podcast before,
Mhm.
if I remember correctly. He's a beautiful bridge. Like, I love Lewis. He's one of these people who doesn't say I'm an expert, but he's got this enormous reach and he brings such valuable information to so many people. So I think you've got to be careful. And I've worked with a fair amount of influencers who do have this imposter syndrome. Oh my gosh, people expect things from me now because I'm popular, right? And so how to navigate is tricky in that world. So I'm not going to say, oh, it's no good. I'm going to say we have to be thoughtful about it,
Mhm.
because getting this information to the masses is really important. Psychotherapy, in my estimation, Joe, and this is maybe a provocative statement, we do not, it's a limited resource for the amount of people that are ailing in the world. We are not going to
Mhm.
solve trauma through psychotherapy, in my opinion. It's people don't have access to it. It's too expensive. Insurance companies regulate it. We've got to get access to these people in a different way. So it's a blessing and a
Mhm.
curse.
Yeah. Well, and I think that also then we hear certain terms that kind of take off and almost get a meaning that isn't what the academics think, isn't what the diagnosis criteria thinks. But
Yes.
then the general population thinks they know what it means. And I want to throw some of those terms at
Oh,
you.
I've
And
got
I
a
want,
term. You give me
yeah,
your term, and I'm
I'm
going to
going to
give
give
you
you,
my term.
yes,
Go ahead.
exactly. So I'm going to give you a couple terms. I want you to just
Yeah.
play with those and define them how you would, what you wish
Yeah.
therapists, because primarily we have therapists that are listening. And I
Yes.
think that one of the beautiful things is that a therapist is talking to these people that hear these terms all the time and can say, hold on, let's make
Yeah.
sure we're talking about the same word. Let's
Yeah.
make sure we're defining it in the same way, because the way you might be defining it could be different. And it can shift that individual to then think differently about terms like trauma. So, I
Yeah.
want to take the words like trauma, complex PTSD, big T trauma, little t trauma. So all those words associated with trauma, dissect that for us and add or take away whatever you want.
Absolutely. So we could start with trauma, because there's this trauma. When I think about trauma, I think about intensity, frequency, and duration. Right? People have an experience. People have gone through something, and you need to look at intensity, frequency, and duration to think about severity. Different people perceive the same events in very different ways, based on their history, based on their temperament, based on a lot of factors. So you have to take each case individually. And trauma is what happened to you. It's the experience that you went through. Your response is very important. So I think about, what did you absorb? What did you go through? And how are you responding to it? And because PTSD is a response to trauma, it's not the event itself, it's the symptoms that you display as a result of not being able to adequately process the event that you went through. So we've got to differentiate what you went through, what you're carrying, versus how you're reacting or responding to it. And it's a lot about perception. One kid gets bullied on the playground and he fights back. Another kid gets bullied on the playground and he becomes suicidal and kills himself. Do you know what I mean? So
Mm-hmm.
there's a lot of variability into how we perceive it and how we react and respond to it, based on our temperament, based on resilience. So everybody's different. Some people overuse the word, like if you're a Gen Z, you sneeze and you have a trauma. I mean, this poor generation has been through a global trauma, which in a way that none of us have when they were early developing, right? So I don't want to minimize the impact, but the younger generations tend to see everything as trauma, and the baby boomers are like, hell no, not me. I don't have trauma. So you have even different generations responding differently based on what happens in the world, right? Complex PTSD or relational trauma is exactly that. It's trauma that we have as a result of relationships. So complex PTSD and relational trauma are interchangeable. So Bessel van der Kolk, who I've been working with since 1992, has really tried to get complex PTSD in the DSM. Never was able to do that, right? A lot of research says when you are relationally violated in childhood, in young adulthood, in your early life, it has a huge impact on you. So we're looking at relational violations, right? We look at the ACE studies, the adverse childhood experiences. That's all about relational trauma. And you're looking at how we are affected by growing up in dysfunctional families and what impact that has, which is very different than a car accident or a global pandemic or cultural or systemic trauma. So we look at relational trauma. That's probably what most therapists see in their office. And that's probably the hardest to treat, honestly, is because these are not one trauma. These are thousands and thousands of traumas, because these relational violations, when you're growing up, say with a alcoholic father or a depressed schizophrenic mother, hundreds of them happen a year. Do you know what I mean? So it's not like you recover easy or quickly from it because of the repetitive nature of relational trauma.
Thus
So
making it complex.
it's very complicated, and it is a different set of responses and reactions outside of what's called traditional PTSD, cluster 1, cluster 2, cluster 3, intrusive images, numbing avoidance, hyperarousal. That's with traditional, if you will, trauma, versus relational trauma has very different symptom complexes. This is where, excuse me for saying this, but women with trauma histories get called borderlines, and men with trauma histories get called narcissists. Those are the types of reactions and responses to relational trauma that people experience. Different than PTSD, right? When we're talking about big T, little t, that is another thing that kind of drives me crazy a little bit. It drives me crazy because who the hell is determining the big and the little t? That's the issue that I have with big T, little t. Like somebody outside of the person experiencing it, that's big T trauma because there's blood and broken bones. Oh, that's little t trauma because you were kind of bullied on the playground. Like, it's all about the experience of the individual. Let them determine whether it's a big T, little t for them. We can't compare traumas when we have such a wide range of reactions and responses to it based on many different factors. So, whoever's judging the severity of the trauma needs to look at themselves a little bit and think about asking and listening, not telling about the intensity of the experience that the person has had.
Mm. I think that leads us into, what do we get wrong in psychotherapy?
Yeah, this is where I get really
I know it's going to
excited.
rile you up. I
It's
want to get
gonna,
you riled up,
you're
Frank.
gonna rile me up, but in a good way. Like really, I've been doing this work since 1992. I've been doing this a long time, and I've been in the field of trauma most of my life. I have a pretty significant trauma history myself, and that's why I wrote my memoir, To Be Loved. Like my memoir that just came out in May is about my trauma history, starting very early in my life as a baby in the crib. Being in therapy at 6 years old, a form of conversion therapy, having an abusive father physically and verbally and a very passive mother. So I kind of have all the PTs and the SDs of trauma, honestly. So when we look at our field of trauma, like, and I've been in therapy for over 34 years, Joe. So I'm a therapy lifer. I was in therapy for 6 years as a kid, from 6 to 12. Then I was in therapy 5 times a week for 11 years during my residency training program. And when my first son was born, I think my first son was like 2 or 3. I've been in therapy with him and with myself ever since because my trauma history resurfaced. So I think there's enormous value in our field, and I think therapists, and I'm putting myself in this category as one of us. We have this tendency to keep people too long in treatment, in my view. Everybody's fighting insurance companies, and I'm not saying insurance companies are correct with their managed care mentality, because that's not what I'm saying. What I'm saying is we can get people focusing on their origin story in the core root of their problems, which are important to visit, but not important to stay stuck in. So I really think it's important for people to visit their histories, but visit them, not slip into 10 years of therapy once a week
Mm.
with no real change in your life, right? So there's a way that we can regress people and get them dependent on us relationally in a way that I don't think is helpful. Some people with attachment trauma definitely need a safe object in order to feel safe to go there. That's true. And we have a tendency to kind of keep people longer than is necessary and not giving enough agency and power back to the client, in my view. Now, I'm also thinking about coaching because that's a whole nother world, right? Coaches, on the other hand, are all about move forward, focus on the future, focus on the future. Do these 5 things and you'll get better. I'm also saying that's not really the solution either. If you don't look at the origin, you're never going to just override with behavior. So I'm not a big fan of coaching only. What I'm kind of trying to do here, Joe, in my new way of thinking about trauma treatment specifically, is combining psychotherapy, neuroscience, and coaching. Like, let's visit the past. Let's use the knowledge we have to inform therapeutic decisions. And let's really have people do things differently in the present once they've released the energy that they're carrying from their past. So I've got a program that I'm creating that I'm really wanting people to kind of move forward and give these decisions back to clients. Because with trauma, agency has been taken away from you. That's kind of the definition of trauma. So I want clients to be in charge of their treatment plan. I want them to decide how many sessions of EMDR they need. I want them to get educated and reach out to a therapist and contract for 5 or 10 sessions or whatever it is, right? And I want the therapist to be the the adjunctive coach of the client instead of the one that's making the decisions and coming up with the interpretations, because that's how clients get dependent on therapists from my perspective. So I
Mm-hmm.
know this is kind of a radical view, and I might be pissing people off, which I'm hoping I'm not, because I think therapists are burdened and overwhelmed by the current way things are being delivered. And my hope is that therapists are freed up from kind of seeing people forever and ever and ever with no real progress. And they have really important impact in time limited, specific kinds of ways. So I want therapists to feel freed up and feel better about the work they do. And I want clients to kind of be more in charge, gain their agency of what they're going to do. And I do think from a trauma perspective that integrated trauma treatment is really the best approach for a therapist. You know, I'm a big IFS person, but IFS isn't for everyone. I'm also trained in EMDR. I'm trained in sensory motor psychotherapy. I'm going to take neurofeedback training. You know, I think we as therapists need to be trained in multiple modalities because we need to pick and choose, or the client needs to pick and choose which modality we're going to use on which behavior they're trying to work on. For
Mm-hmm.
example, I want to work on my reactivity. Great, let's focus on your reactivity. That's the focus of the work. What kind of work are we going to do? And how many sessions are we going to do it? And how are you going to make changes in your life? And how do we give you accountability for that? So, like, as you can tell, I've been thinking about this a lot lately,
Mm-hmm.
and I really am going to do my best that I hope will benefit therapists and benefit clients so that more people can gain access, self guided, self directed, and reach out when they need it to be able to reach a broader range of people who are suffering from trauma who don't have the financial means to pay out of pocket.
Mm-hmm. As a therapist, I can tell you from experience that having the right EHR is an absolute lifeline. I recommend using therapy notes. They make billing, scheduling, note taking, telehealth, and e prescribe incredibly easy. Best of all, they offer live telephone support that's available 7 days a week. You don't have to take my word for it. Do your own research and see for yourself. Therapy Notes is the #1 highest rated EHR system available today, with a 4.9 out of 5 stars on trustpilot.com and on Google. All you have to do is click the link below or type promo code Joe on their website over at therapynotes.com and receive a special 2-month trial absolutely free. Again, that's therapynotes.com and use promo code Joe on the website. If you're coming from another EHR, Therapy Notes will also import your demographic data quick and easy at no cost, so you can get started right away. Trust me, don't waste any more of your time and try Therapy Notes. Just use promo code Joe at checkout. Now, Frank, I imagine there's some internal pushback some people might have, and
Of
you know,
course.
I'm thinking about, you know, like recently, both of my back two tires of my truck, both started
Yeah.
to have alerts that they were low air pressure. So I was supposed to
Yes.
drive, 3 hours south to Kalamazoo for, an event with some friends. Like within 2 hours, so I went to my favorite like local tire place. They found that there was like a screw that had somehow wedged itself in one of the tires, and they fixed it up and did it. Now, I think that's the mindset that most people have with therapy
Yes.
is
I
I have a
know.
problem. Or even with doctors, I have cancer, I have type 1 diabetes, I have whatever.
Yes.
I don't even know what options are out there. Like, I don't know what EMDR even stands for. How can
Yeah.
I know how many sessions I'm going to need? So parse that out for me as to what that collaboration with a therapist looks like with this new model.
Absolutely, absolutely, and it's a legitimate concern. One of the things I want to do in this new program is I want to I want to do an assessment tool. I'm creating an assessment instrument where people take a question, fill out a questionnaire, and it deals with their symptoms, it deals with their history, it deals with their family of origin, and kind of give them a printout like a prescription. Like, here's the kind of trauma you have. This is the kind of symptoms you're struggling with. This is the range of you based on what you've said to me. And here are the different options for you. Like, if you've been bullied on the playground, this is a way to go. This is what diagnosis you may have. And this is one path. If you've been ritually abused since the age of 3 in a dysfunctional cult family, this is the kind of diagnosis you have, and this is the kind of treatment you have, right? So the people have to be educated, and they have to get an assessment because they don't know that, right? And education is key. So not only is the assessment and the prescription important, so is the education about the different um, access to different types of treatment, right? Psychotherapy is one of them. Coaching is another one of them. Yoga is a form of treatment. There's a lot of different ways. Journaling, meditating, right? So people to get educated by the different range and options, and for them to pick and choose what they need in what order with support. I also feel like there needs to be a peer-to-peer support component to this program, right? So that maybe you can run things by a peer in a different way than you run things by a trained professional, right? So what do you need when? When do you need to go to a therapist? When can you do it in journaling or on your own? Like, to give people more agency and education around when they do need to reach out. Could you do, massive trauma healing all on your own? That's really hard. That's really, really complicated. Does everything need to be done inside of a therapist's office? Maybe not. Maybe not. I had the experience, Joe, with my father, who was my primary abuser, outside my kind of mom being very passive. And I can tell you, I did so much work in my relationship with him that I could have never done in psychotherapy. But I had to do enough work in psychotherapy to be able to show up with my dad differently. You know what I mean? And I want people, this is why I really want to bring the coaching component in, is I want people to utilize life much more than we do in psychotherapy. We do a lot of processing in psychotherapy, and I think we need to get people in their lives making changes. I've been such a conflict avoidant person much of my life. And honestly, I could talk about being conflict avoidant a lot in therapy, and it didn't make change for me. And it's not until I have enough self esteem, I've released enough of my trauma that I'm able to show up with people that I'm in conflict with and do it differently. So I think therapists can have a huge role in helping ready people to be more active to make change in their life. It's one of the things I'll say that neuroscience shows us, which is memory reconsolidation, a form of rewiring neural networks at the synaptic level. We need a disconfirming experience in order to change neural networks. What I mean by that is this: if you feel unloved, in order to change those neural networks in the brain, the ones that hold the trauma around being unloved, you need to have experiences of being loved. Okay, but it's part of the healing journey, not the only healing journey. There also needs to be a witnessing, a sharing the experience, having a corrective experience in your present day life, and then you can release and let go of what you're carrying. So I really want to combine the best of coaching, the best of psychotherapy, and the best of neuroscience to maybe make this a little bit more accessible and a little bit more efficient for both sides of the story.
I always love asking guests, like, what does this look like in your own life? So you have all
Yep.
this knowledge, you've been in
Yep.
therapy for years. Like, what's your practical, either daily, weekly, monthly, annual habits, things that you do
Yep.
that enacts the stuff you're talking about?
Absolutely. I'm a big fan now. I work a lot. I'm a super busy guy and I do a ton of stuff. But the way that I access my internal world is by going out for a run in nature with music. That is the way I can access my internal world. That's the way I can do some of my most profound healing. Do I also still have a therapist? Yep, I see her once a month, and I will continue to see her once a month for as long as her and I will both do that. But I go deep. I do a deep piece of work with her, and then I do the journaling myself. I do meditating myself, mostly through my meditative experience of running, honestly. It's like I do bilateral stimulation by running. I think I'm doing EMDR, honestly. So
Yeah.
I do my work with my therapist and I do my work in my life. Like I'm in the process right now, honestly. There's been, because of my relationship with my dad, right, who primarily a kind of a pretty narcissistic person, I've attracted a bunch of narcissists in my life. Yeah, surprise, like shocking.
Mm.
And I am really working to show up in these relationships differently. I'm speaking up. I'm having agency. I am I'm not I'm not accommodating or passive anymore like I used to be, and it's kind of the consciousness and the deliberateness of visiting my history, not reliving my history. When people, I don't even like to use this word, Joe, when people are triggered, that's a sign that something unresolved is inside of you. That is your opportunity. That is your wake up call that there's work. You are carrying something that you need to release that doesn't belong to you. And so every time we get triggered, it's an opportunity to change what you've gone through, to release what you've gone through, and to do it differently in the present day, because people get triggered about some sliver in the present, but it's mostly about their history. And that's because they're still carrying it. They have to release it so that they can show up with their narcissist in their present day life in a different way. So, you know,
Mm.
I some people out there, if you're new to this field or you haven't been working in trauma or you're really burnt out and overwhelmed, I want to let people know I'm doing this for a long time and I'm excited about maybe changing this paradigm a little bit so that it's a win-win for all of us. And I'm doing a lot more work on my own in my present day life, visiting my history, and showing up differently in my life than I've ever done before. Because I was one of those people who was very dependent and relying on my therapist over the years to kind of help me make decisions instead of, you know, gently nudge me to take the risks and then to help me sort it out after the fact.
Mm. Well, the last question I always ask is, if every private practitioner in the world were listening right now, what would you want them to know?
Every practitioner, yeah, I would say that there's a better way for us to deliver care. I want people to know there's a better way for us to deliver care. We've come a long way in this field. I'm grateful for the model makers that have moved our field forward. And I think the next generation of healers are going to integrate things, put it together, and bring the delivery of care to people in a very different way, probably even including technology. People
So
may not want
awesome.
to hear that. People may not
No,
want to
that's
hear.
okay. We've covered a lot on AI and its integration and things
Yeah,
like that. No, I think that's wonderful. We have a bunch of episodes on that.
yeah,
Frank, if people want to follow your work, if they want to just read your books or do anything, following Frank, where can they follow
yeah.
Frank?
Best way to follow me is probably through my website, which is frankandersonmd.com. And you can sign up for my newsletter there. I'm also very active on Instagram, Frank underscore Anderson MD. I'm on TikTok now. I'm on Facebook. I'm on YouTube. So my website can connect you to all my social media channels and my courses and workshops and webinars that I do. So, yep.
So awesome, Frank.
Definitely.
Thank you so much for being on the Practice of the Practice podcast.
Thank you for having me. I really appreciate it.
As we do shows like this, it's just, it's so interesting to now have interviewed over 1,100 people on this show and to just see these common threads of coming back to ourselves, even just that idea of, encouraging clients to take the reins, to be in the driver's seat of their own therapy, and to really invite us to come alongside. Even when we do consulting with people to grow their practices, I often say, you've invited me into your business. There's no wrong in regards to what you're doing. In improv, we say there's no right or wrong in a scene. There's just easy and hard. I can do things for my scene partner in improv to make it harder for them or easier. And in some scenes, it's funny to make it harder for them. In other scenes, it's funnier to make. A good therapist and a good consultant will come alongside you and help you understand and learn and grow, and then say, I want you to fly on your own without me being here all the time. Frequently when someone comes to me for one-on-one consulting and we work through an issue and put out a fire, I then say, here's my thought process and how I worked through this. Not just answering your question to make you dependent on me as a consultant for your practice, but instead to say, yes, we put this fire out, but let's work upriver and figure out what's causing this, and so that you can learn to think in the way I think, instead of just being dependent on me as your lifelong consultant. And so I think that's so important to see. All these different interviews, often are pointing at the same sort of thing. And to me, that's why it's important to be in community with people. It's important to be around other people that are headed in the same direction. That's where our memberships come in. We have memberships, different tracks for every single phase. You can read about those at practiceofthepractice.com/membership. We also couldn't do this show without amazing sponsors like Therapy Notes. Therapy Notes is the best electronic health records out there. They will help you switch over from your current EHR. They also give you 2 months for free or just money off if you use promo code Joe at checkout. They are phenomenal. They help with automated billing. It's going to make it easier to outsource your billing. So many reasons to switch to Therapy Notes. Just head on over to therapynotes.com, read about it, and at checkout, just use promo code Joe. Thank you so much for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music. And this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.